it's Michelle from Morristown TV today, here with Miss Sherry from the Health Department with an update about the Health Department and what they have going on. Sherry, before we talk about the obvious conversation, I think we need to point out that all your other activities and events are still happening, right?
Well, that's right, Michelle. All the usual health department programs, we want to remind everyone, they've always continued through our pandemic, and they're continuing to go on now. All the services such as WIC, family planning, immunizations, birth certificates, death certificates, are continuing to go on either in the parking lot or as a telephone service. In fact, we recently received news that remote WIC, or providing WIC services over the phone, has been federally extended through May the 20th.
Oh, that's wonderful.
So that will continue yet for a period of time.
Well, that's fantastic. And even for just general information about the health department, if somebody needs something but they don't necessarily know what they need, whether it's WIC or immunizations for their children, they just need to give you guys a call and schedule that, right?
That's fine, yes, at 423-546-9221 and press 0.
Okay.
We'll take care of their needs.
Well, let's go ahead and talk about the obvious conversation piece here. Let's go ahead and talk about the massive amounts of immunizations that are happening right now. I know you guys are super swamped. So, how is everything going? Do we need to talk about what phase you're in as far as the shots, or what do you... I'm just going to give it to you and let you tell everybody what they need to know.
Well, thank you, Michelle.
You're
I'll be
welcome.
glad to do that. Yes, we're currently very involved in providing the COVID vaccinations. We're grateful that we have the opportunity to do this. We do the immunizations Monday through Friday at different hours. On Monday, Wednesday, and Friday, we basically do them all day. We've just converted to providing these immunizations as a drive-through clinic. And this drive-through starts behind the old MUS building, Fibernet building, and proceeds through the back of the parking lot and then up around through the health department, so that no one really has to get out of their car to get their immunization. We do have people directing traffic and signs so that no one gets lost.
Okay.
But we are currently vaccinating for those in phases 1A1 and 1A2. That includes all of our healthcare providers. It includes our home health workers. It includes first responders. Also, adults and children 16 and under that have a chronic disease or illness or developmental disability where they cannot live alone are included in this, as well as school and university healthcare workers such as school nurses. It includes funeral directors as well. So basically, those categories in phases 1A1, 1A2, and then age-wise, we're vaccinating those who are 70 years of age and older.
Okay, well, let me ask you a question. I don't mean to cut you off, but if I just want to ask you this because I'm sure if I'm thinking of it, somebody out there is as well.
Right.
If somebody is a first responder or a director at a funeral home or whatever the case may be, when they call, do they need to show, obviously, some kind of ID to prove that they are in the medical field or that they are over age 70? I mean, it's not just I'm 70 years old, I need a shot, and I get in line. I mean, do you have to prove that you fall into that criteria?
Well, we take the appointments, and as we verify their eligibility as we take the appointment.
Okay.
Right now, we're currently working the waiting list for those who are 75 and older, and then those 70 and older have recently been added as well. So the majority of those we're vaccinating now are in that age category. Basically, for Hamlin County, I think we've pretty well covered all those in phases 1A1 and 1A2. And we started last week actually giving the second doses for many of those individuals that were vaccinated at the last of February, or I'm sorry, the last of December and the first of January. And a reminder that the vaccine that we have now is Pfizer, that all of our vaccines, the COVID vaccine is free of charge for everyone. We are working this waiting list as quickly as possible because we know there's a lot of anxiety out there to be able to move on. But we are following the state COVID vaccination plan as far as the next phases that we will move to. And doing that, we will do that as quickly as possible.
So I know if people would just be patient, because I know it's important. It's important to you. It's important for your family members. But please be patient, because, again, this is a learning curve for everybody. I mean, it's brand spanking new for the state, for you guys, for just everybody in general. So
that's true.
Yeah. So please be kind and be patient. They're doing the best they can, and I think you're doing a wonderful job at that.
Well, thank you.
I want to ask you another question, and I'm curious about this. So if somebody gets their second dose, their second vaccine, and I don't know, 2 or 3 months later, are they good to stop wearing a mask? I mean, so is that what the purpose of the vaccine is? Obviously to keep you from getting COVID, but do they still have to follow all of our regular precautions with the distance and the mask and so on?
Oh, yes. And I'm glad you asked that. That's a very good point. All of the measures that have been important before, such as wearing a mask, maintaining social distancing, hand sanitation, all the sanitation measures, they're still just as important as ever. It's just that now we have another resource to help us fight COVID and help prevent the spread of the illness, and that is the vaccine. But all of those other measures are still just as important as they were before.
Okay. Well, let me ask you this: Are you? And if you're not comfortable answering this, you don't have to. But it seems like over the past few days, maybe past week or so, there's a bit of a decrease in the numbers. Now, and again, if you're not comfortable with this, that's fine. But is it because that there aren't as many tests, or is it because, I don't know, the vaccine's already starting to work? I mean, do you have any idea why we're seeing, which is a positive, of course, that we're seeing a drop-off in the numbers?
Well, it is true that our testing numbers at the health department have decreased somewhat, so that could be a factor. Also, having started vaccinating around the end of December, we do have several individuals now as of today that have received their second dose. It takes approximately 14 days, though, before the second dose to have the full efficacy. So I don't know. Hopefully that's starting to be a factor, but that will be more and more of a factor as we get more and more people vaccinated, obviously. So we're just hoping that there's a general decline in the spread of COVID.
Well, and talking about the testing, again, you're testing still, but you're doing it 2 days a week. Am I correct?
Well, actually, we're providing some form of COVID testing 5 days a week.
Oh, okay.
On Monday, Wednesday, and Friday, we are vaccinating all day long, but we're also on those days offering the Everly Wells self-COVID test. And this is a kit where individuals can come and with an appointment, if they are 16 or older, have their own smartphone and have their own email account, then they're eligible to have this self-kit where they test themselves, and we instruct them on how to do that, and then they can leave it with us and we can send that off in UPS.
Okay.
The results of those tests, though, come directly back to the person. They don't come to us. Okay. But that's Monday, Wednesday, Friday. Then on Tuesday and Thursday mornings, we can on-site PCR COVID testing at the health department, and that's from 8 o'clock to 11. Okay. And then when that's done, we pick up and start doing the vaccinations on those days. So we're trying to keep all things running every day as much as possible.
Well, it sounds like, and again, I commend you for what you do. And I know you bounce back and forth between Hamlin County and Jefferson County, so you definitely have a full plate. Thank you so much. You know, again, I say thank you for what you do, and I hope you know I am ever so serious about that, because this is a big responsibility. And, you know, again, folks, please just be kind and be patient. You know, it's a big deal to a lot of people. But you know what? We're all only human, so please be patient. And if you are on the waiting list, they will get to you. And if your category is coming up, just hold on. And in the meantime, wear your mask, wash your hands. be smart and be safe.
Could I also mention about how to get on the waiting list?
Oh, absolutely. That
Because
might be
that's
important.
coming up, yeah. There is a phone number that would be helpful for everyone to know that's a statewide number, and that is 866-442-5301. This can help you not only get on a waiting list if you are categorically eligible or age eligible, but it's also a place for COVID questions to be answered. And also, up to this point, our appointment system has been through Sign Up Genius, but that's going to be changing around February the 12th or so to a new statewide system that will be a Microsoft platform. So I just want everyone to know that we'll get the word out there about how to do that. But that phone number will still be in effect to help people, guide people as well.
Okay, and also if people aren't sure which category they fall under, they can get that on the website, correct?
That is
on the
correct.
Tennessee Department of Health website.
COVID website has a wealth of information there.
Yeah, and again, that's a wonderful place for you to go to get some questions answered. You know, folks, thank you so much for staying tuned to Channel 7 Morristown TV today. It is very important for you to find out this information, and I can't imagine a better person to share that with you than Miss Sherry. So thank you, and thank you for watching Morristown TV today. We'll see you next time.